Hello everyone, thanks for joining our Facebook Live. Our topic for today is what is chronic venous disease, brought to you by Columbia Asia Hospital, Petaling, Jaya and Severe. So before we start, I would like to remind everyone that there will be a Q&A session towards the end. We would love to hear from you, so please feel free to leave your questions at the comment box below anytime during the presentation, and our speaker will answer it after his presentation. Without further ado, I would like to introduce our speaker today, Dato Dr. Ho. So Dato Dr. Ho is a consultant general and vascular surgeon in Columbia Asia Hospital, Petaling, Jaya. He was trained under the world-renowned vascular surgeons from the Royal Free and University College Hospital, London. He has worked in the United Kingdom for over 15 years. He was then being recruited from London back to Malaysia under the Malaysian Talent Corps Expert Program to set up and provide a vascular service of international standard at a private hospital. So his practice in vascular surgery ranges from the treatment of spider veins, varicose veins, diabetic foot ulcer, to major surgeries, for aortic aneurysms. His practice in general surgery includes the treatment of gallstones, appendicitis, hernias, breast lumps, thyroid diseases, laser hemorrhoid surgery, laparoscopic surgery, endoscopies, and so on. So now I would like to pass the mic over to Dato Ho. Let us welcome Dato Ho.
Okay. Thank you, Valerie, for the introduction. Very good afternoon. Thank you for joining this today's afternoon. So the topic is what is chronic venous disease? As the name implies, chronic means it's a problem of long term. Venous means it's regarding the veins in our body, or rather the legs more specifically. So it's a disease, it's a long-term disease involving the veins, especially the legs. So why are we talking about it this afternoon? Because it is a very common problem. And unfortunately, there's a lot of misinformation about this problem. So let's go through and see. So you can see on this picture, there is a lot of big veins, which we call varicose veins. Now, a lot of times patients will come and see me when they are very, very late and advanced in the stage of the disease. And when we're being asked, why didn't you come earlier? The first thing they will say is, oh yes, I've seen doctors before and I've been told that it doesn't matter, it doesn't cause any problems. We will see later what sort of problems it can actually cause. The other, second common statement is that, oh, it's okay, there's no treatment available, just live with this. Again, it's misinformation, and we will see what sort of treatments and the latest techniques that's available to treat this problem. Okay, let's proceed. What is the function of veins? Now, as you can see on the picture in the left side here, there are a lot of veins in the leg. And the main thing is that there are two systems. One is the vein which is deep in the leg, which is called the deep venous system, and another system which is closer to the skin, and it's called the superficial venous system. And you can see that on the picture on the right side, the veins have got these valves. Now these valves will help to push along the blood to go out one way direction back to the heart, because the function of the vein is to bring the blood which has been used up back to the heart, and it recycles over again and again. So in this chronic venous disease, this is the healthy vein, and now you can see the valve open and close, and then the blood does not come back down. In this vein which is damaged, you can see that the valves here, it just flaps, open and doesn't close, and there is a gap in the middle in which the blood will leak down. So that will lead to, once the blood is leaking down, that will lead to a lot of blood which is pooled in the leg, especially in the lower part of the leg. So what you can imagine is you have a tube, a rubber tube, which represents the vein, and you fill up with a lot of water, and the whole tube will distend. So in this case, the vein will be filled up with a lot of blood because the blood cannot leave the vein, and therefore the vein will become distended, it becomes big. So when somebody has the symptoms, what are they? So before we go through this, I want you to ask yourself, or rather, first of all, look at your legs. Are there any veins in the legs? And think about what you may experience in your legs. What sort of problems? Okay, before we go through the symptoms. And I'm just going to share with you now, what are they? Visible veins. You can see on the picture here, there's a lot of veins very prominently seen on the skin. And this is what we call spider veins or reticular veins. In this picture here, you can see all this tortuous vein which is dilated. And this is what we call the varicose veins. Occasionally, patients can have pain in the leg, aching or discomfort. The legs may feel heavy because there's a lot of blood. You may feel burning or throbbing in the legs as the leg is filled up with a lot of blood. It feels warm, and therefore you feel it's a burning sensation. There are also patients who can complain of cramps at night, and this will lead to sleep disturbance. You can see here, the left leg is a lot bigger than the right leg. And the left leg is swollen, and the ankle here is also swollen as well. Dry, itchy, and thin skin over the affected vein. So in this picture, you can see all this skin that is darkened and looks very dry. Patients will then tend to scratch over this area, and then it will lead to the skin breaking down. Others, you can just see there's very dark skin, especially in the lower part of the leg. And this is because the lower part of the leg has the highest hydrostatic pressure, or rather the pressure in the vein is the highest. Therefore, it leads to all these skin changes. Here you can see there is an ulcer. The skin is broken down. And usually when this happens, the ulcer will not heal easily. This patient here has this ulcer for up to 12 months. And the problem is that because it's caused by the vein, and if the vein is not treated, then the ulcer is not going to heal. So we have to treat the source of the problem, the cause of the ulcer. Bleeding after minor injury. So in this area here, you can see there is this dot or a small little lump. This is actually the vein. And the overlying skin has become very thin. And look at the color here, is very purplish. So any minor scratch or just a knock, then this blood will spurt out. There are also patients who unknowingly during their sleep, they may have scratched it, and when they wake up, they will see that the mattress is stained with blood. So this is how the patients commonly complain of when they come to see a doctor. When it gets more serious, you can see this is actually a leg, and all this red color area here is actually the vein. And now inside the vein is filled with blood clot. Because the blood is not able to flow in a smooth manner, it's stagnant, and therefore it tends to form blood clots. And when these blood clots become very extensive, you can see that it will start to travel up from the superficial system, which we spoke about, into the deep system, the deep vein. And this is a condition we call a deep vein thrombosis. What it means is that there are blood clots in the deep vein. So this is a serious condition because when this blood clot in the deep veins breaks off, you can see here, it can break off, and then it will start to travel up the system into the heart and then into the lungs. And it will cause a blockage of the pulmonary artery, which is the artery in the lung. And if the blockage is severe enough, it can cause death. So a lot of times, people may just collapse, especially when they have deep vein thrombosis and they go for a massage, and then the massage will break off the clot, they travel to the lungs, and they die suddenly. So who are at risk of developing chronic venous disease? Being female, we're not trying to target on the female sex, but we know that it's actually related to hormones. There are hormones in the female system that can make the vein wall become more relaxed, and therefore the veins tend to distend easier. Having a close family member with varicose veins, which means occasionally it can run in a family. So patients usually, they will have either their mom, the siblings will have the same problem. Being older, so as we grow older, the body becomes weaker, so it's all these walls in the veins, they become weaker and tend to become dilated or become stretched. Being overweight is a significant risk factor because there is extra weight on the tummy. The tummy fat will put the stress on the veins, and therefore the blood may not be able to flow easily back up to the heart. People who stand for long hours. So a lot of the times, the patients work as hawkers, teachers, those that stand long hours during their occupation. So they will have this problem. Being pregnant, again, pregnancy can cause varicose veins because of the changes in the hormones, as well as the baby pressing on the veins. Now, other conditions such as deep vein thrombosis, because the deep vein thrombosis can cause damage to the valve. Blood clots that stays in the vein can damage the valves, and therefore the valves will not be able to close properly. So these are a few of the risk factors. It doesn't mean that if you don't have any of these risk factors, you will not develop CVD. A lot of times, most patients, they don't have any of these risk factors and they can still develop this venous disease. So when you see a doctor, or rather a vascular surgeon, now a vascular surgeon means the surgeon who deals with blood vessels. The blood vessels can be arteries or the veins, and therefore they are the right people to treat this condition. So if the veins or the varicose veins are causing pain or discomfort, if the skin over the veins is sore or irritated, like we've seen, it becomes darkened, thin, itchy. The aching in the legs is causing irritation at night and it's disturbing the sleep, like we've talked about night cramps at night, or any of the symptoms that we have just mentioned. So then if you have all these or any of this, then it will be advisable to seek a professional help. So when you go and see a doctor or a vascular surgeon, what do? So very importantly, we do this ultrasound scan of the venous Doppler. So we need to scan the vein, And this is basically an ultrasound scan, just like any ultrasound, like scan for pregnancy. So we look at the veins. The purpose of doing the scan is to check which vein is damaged in order for us to treat it. And again, it's advisable that it's to be done by the person who's going to do the operation. So what are the treatment methods available? Number one, medical treatment. So medications which contain this substrate, diosmin or hesperidine, this has been proven to treat the symptoms, to alleviate the symptoms, and also the leg swellings. It can also be combined with other procedures, which we'll go through later, for the treatment of varicose veins. And also it can help to heal the venous ulcer, taking a shorter time for it to heal completely. Besides medical treatment, is open surgery. What we do in open surgery is that make a cut here. Now, and then we tie up this area. So the reason we want to tie this area up is because the blood goes up and then it can click down on this vein, for example. So therefore we disconnect it so that we don't want any connection for the blood to flow back down. It should flow back up straight away. And therefore this vein is removed, it's been stripped. However, this operation is not the latest technique. It's been on for many years. The certain things about this operation is that it requires general anesthesia. So it may not be so suitable for elderly patients because most of the patients are elderly and they may have some other problems, heart problems, diabetes, and this will pose a risk for the general anesthesia. Bleeding and bruising. So imagine you have to strip the whole vein out, it's bound to bleed, and the thigh may be swollen and bruised. Wound infection, you have a cut here, and this is in the groin area, so there's a lot of movement, and it's not the cleanest part of the body, and there is a risk of wound infection. And you have a scar once the wound has healed, and there is a high risk of the vein growing back because when we do it, you can only see with the naked eye this vein, and therefore only this vein is being removed. You can't really see other veins, even though they're present. So this is about open surgery. Now what are the other treatment techniques? So it's called the minimally invasive procedures. So this is the recommended treatment techniques that can consist of using a laser or a radio frequency or even a simple injection of medicine. We call it sclerotherapy into the vein. So again, you can see, let's say for example, the blood goes up and it leaks down. So this is the vein that we want to treat because this is the part where it's leaking down. So as you could recall, we make a cut here in open surgery and tie this up. And then we strip the whole thing so there is no more communication for the blood to flow down. So in this technique, the minimally invasive techniques, we use laser, for example, and we laser this whole vein. We laser the whole vein and we shut this whole vein down. Therefore, there is no more channel for the blood to flow down, and it will only just flow up back to the heart as how it should be. So just to share with you the video of how this laser is performed. So this is the laser catheter. As you can see, the laser is being pulled out, and this is the laser. So that's how we do it. So we insert this laser into the vein, just below the knee, goes up all the way to here. Now the blood will go from here, goes up back to the heart. And therefore, once we laser this part, the blood, when it reaches here, it will go up to the heart. So therefore, all this is lasered very easily. Good. So then the whole laser is removed. This is another technique, injection foam sclerotherapy, which means it can just be done by injection in the clinic setting. Don't really need to be admitted to hospital. And that's how you do it. Under the ultrasound, you can see on the ultrasound screen here, and this is the needle going in. At the top here, you can see that's the needle under the ultrasound view. And then when we inject the medication, it goes white. It's coming, that's it, there you go, it goes all white. So this is another very simple method to treat these venous problems. So what is the advantage of minimally invasive procedures? Hardly visible pinhole incision. So don't really get a scar. It's just a needle hole, a very small needle hole, about 1 millimeter in size. Far less bruising, so we do not remove any of the veins. It will shrink on its own. We don't pull anything out, therefore it's not going to bleed or bruise. Minimal pain. Patient don't need to take any painkillers after this procedure. It can be performed under local anesthesia. So again, this is a big advantage because most patients are elderly. They cannot tolerate general anesthesia, and therefore it can be done easily under local anesthesia. It's very safe for them. Walk-in and walk-out procedure, basically after the procedure, the patients can walk straight away. If performed correctly, the veins do not grow back because all these are performed under ultrasound guidance. And we can see any veins that needs to be treated on the ultrasound, and we can treat it at the same time. Excellent medical and cosmetic results. And they can return to the normal activity very quickly. So some of the, just to share some of the pictures of before and after the treatment. You can see this is a retired picture. There's a vein here. One after the laser, this is disappeared very nicely. So it's a good result. Another patient, it's developed bruising at the back of the knee. I mean bleeding because at the back of the knee it rubs a lot when he sits and gets up. When I came for the treatment, and then after that, it's healed very nicely. But this patient has an ulcer. You can see ulcer that would not heal for months and months because it's caused by the vein. And once the vein is treated, the ulcer can heal. Again, you see these typical skin changes. There's darkened. There's an ulcer here. That's before the treatment. So in order for it to heal, you treat the vein as the vein is the cause of the ulcer, and the ulcer heals very nicely. So you have to remember that for ulcer, 80% of the times the cause is caused by a damaged vein. 80% of the times. So 80% of causes of ulcer is a damaged vein. So this is another patient, very serious problem. It comes very late. However, once after treatment, good enough, it healed very nicely. So in conclusions, chronic venous disease can cause serious complications like we have seen. Please get treated before all these serious complications develop. Treatments are very effective, and these treatments are minimally invasive. With that, I would like to conclude today's session. Thank you for your attention. I'll hand you back to Valerie.
Thank you, Dato, for the very informative presentation. So now we'll take some time for our Q&A sessions. So if you have any questions, please leave it at the comment box below. Okay, so Dato, seems like we have a few questions.
Okay. So where is the first question? Shall we start? Okay. From Jailing Chen, if I have visible veins on one of my leg, but no pain or discomfort, do I need to consult doctor? Okay, so basically, you don't have any symptoms. So if there is no symptoms, you may not need to consult a doctor. But however, you should be aware of the possible risks or complications that these veins can cause so that you can look out for it. From Aiden, will my varicose veins reappear after the treatment? So it depends on what sort of treatment that you get, whether it's minimally invasive surgery, whether it's open surgery, and whether it's also dependent on the operator that performed the treatment. So a lot of variables, but if it's done properly using minimally invasive techniques, the risk and the percentage of veins reappear is very minimal. However, we need to caution that in the legs, there are a lot of veins. This particular vein that's treated may not grow back, but there are other veins that can become damaged in the future if you are exposed to the risk factors. Okay. Azizi Aswan, can compression stocking help my visible veins to go away? Compression stockings are recommended as to support the veins. Now, the moment you stop wearing the compression stockings, the veins is still there. So it will not help the visible veins to go away. It can help with the symptoms, but it's not a curative method. In the NICE guidelines from UK, in the past, compression stockings was recommended as an alternative treatment. However, with the availability of minimally invasive techniques and also that the risk of the procedures are minimal, it's recommended for treatments, curative method if there are symptoms, instead of wearing compression stockings. Ryan Bulalov, do I need to treat my varicose veins if it's painless? If I don't treat them, will it get worse? And how quickly will it get worse? Thank you. So if it's painless and it hasn't got any symptoms, you do not necessarily need it treated. But however, you should be aware of the possible risk and complications that can develop so you can monitor for it. A lot of the times, people will have varicose veins and can be there for years and years, but don't cause any problems. Until one fine day, they start to become problematic, getting ulcers as such. So, however, unfortunately, we don't really know why, or certain people, they can get symptoms after a while. Some may not even get any symptoms until the end. So, hope that answers your question. Does Deflon work? Because last time a doctor gave my mom Deflon for her varicose veins. Deflon is a medication containing diosmin and hesperidine. It has been shown that it's good to relieve the symptoms. Symptoms such as aching, and also leg swelling. So it can relieve these symptoms. And also if it's combined with the laser treatment or surgery for ulcers, then it can help with the speed up the healing time of the ulcer. Okay, next. Is it advisable to start treatment early for legs with spider veins? Spider veins, most of the times, they don't usually cause serious problems. So whether you decide for treatment early or not, it's up to the individuals, mainly for cosmetic reasons. But for medical reasons, the answer is not necessary to start early treatment. Next question. Okay, and welcome, Petaling. Okay, that's it. Thank you very much. This is the end of the question sessions.
Okay, thank you, Dato. So it seems like Dato has answered all of the questions. And if you still have any questions, please feel free to leave it at the comment box below. Okay, so if there are no other further questions available, then I would like to thank Dato Ho for his time, and to all our Facebook viewers, thanks for being here. So if you have any questions or any inquiries, feel free to drop it at our social media, drop us a message at our social media platform. Okay, then Dato Ho is going to have a few other webinars coming this week and also next week in a different language. So stay tuned to our Facebook page. Okay, thanks for joining us here today, and we hope to see you again.
Okay, great.